I think the analyses we talked about earlier are really helpful, but the other thing I think is really helpful is to look at how much time has been saved with these treatments. So when we're talking about effect sizes on disease, and we talk about how many points benefit on a CDR-SOB boxes, how many points benefit on an ADAS-Cog, it's very easy to misinterpret these numbers because in early disease where the progression is very slow, you may only expect a point of decline over a year and a half in an early AD population on a CDR-SOB boxes, for instance. And if you only have a point of decline and you're able to slow it down by a half a point, that half a point can be very meaningful. And in fact, over 18 months, that half a point could be comparable to saving someone 9 months of progression with that treatment. And if you can save them 9 months of progression over 18 months, even without extrapolating that, it's still very meaningful. 9 months of less disease could be already enough to make it worthwhile. If you then assume that that same effect kind of builds up over time, then of course it's even more compelling at that point. So I think one thing we need to do is stop haggling over clinical meaningfulness based on points and say half a point meaningful, is 2 points meaningful, is cognition important, is global important, which ADLs are changing. Because as soon as we're talking about all of those things, it's very hard to interpret. You need to know every separate scale. You need to know how big the changes are on those scales. You need a lot of context to interpret it. But anyone can interpret 9 months of time savings out of 18 months of treatment. And so I think the minute we start talking about time savings instead of point benefit, we'll suddenly be advocating for disease-modifying therapies and giving them an advantage over symptomatic treatments. As soon as we start focusing on time and how much time we've saved people, all the effects that we see will be more relevant to people. The arguments around clinical meaningfulness will be easier to just directly address with time savings. And it's really, really important to align the way we measure the disease with the way the disease progresses. And with degenerative diseases, we're still evaluating them in a symptomatic framework, and we really, really need to move to disease-modifying frameworks, or we're not going to get the success that we need in this disease area.